From the JAMA Network, this is JAMA Clinical Reviews, interviews and ideas about innovations in medicine, science, and clinical practice. Here's your host.
Hello and welcome to our listeners from around the world. This is the JAMA Clinical Reviews podcast, and I'm your host, Dr. Beverly Forsyth, an associate editor at JAMA. I'm joined today by Dr. Anna Lok from the University of Michigan Medical School. Dr. Lok and I will be discussing her recently published JAMA review on hepatitis B. Welcome, Dr. Lok, and thank you for being with us today.
Well, thank you for having me.
Yeah, I'm excited to talk to you. So hepatitis B is a DNA virus that causes acute or chronic liver injury, and it can lead to cirrhosis and hepatocellular carcinoma. And it affects an estimated 254 million people worldwide. So clearly a very important virus to understand. And I'm hoping that you can help us today by talking about some of the complicated manifestations of hepatitis. To start, could you talk to us about how hepatitis B is transmitted?
Hepatitis B is mainly transmitted through exposure to blood or body secretions, such as semen. That's why it can be transmitted through sharing needles, either injection drug users, or in healthcare settings where the proper standards are not being maintained. It can also be transmitted sexually, and it can also be transmitted through mother to the baby at the time of birth.
So there are many modes of transmission, and I would say a lot of the people in the United States think of it largely as sexually transmitted or through injection drug use. Maybe you can hit on for us how transmission may differ according to part of the world that you're living in. What is more common in certain regions?
Yeah, you're right in the sense that in the United States, most of the infection occurs among adults. And it's mostly through sexual transmission or injection drug use. But in other parts of the world, it's different. In Asian countries, for example, where hepatitis B remains quite common, although that prevalence has dropped a lot in the last 20, 30 years with vaccination, but it's still relatively common. And therefore, there are a lot of young women who are hepatitis B positive, and they can potentially transmit the infection to the newborn babies at the time of delivery, unless prophylactic measures are taken. Now, in African countries, on the other hand, the risk of mother-to-child transmission tends not to occur at birth because the mothers tend to be e-antigen negative with lower level of virus DNA than the Asian mothers. And much of the spread occurs after birth, for example, during the first few years of life, because of close intimate contact, lack of hygienic standards, and sometimes healthcare exposure or traditional tribal scarification and other procedures not using sterilized equipment. So the spread is different. In Asian countries tend to be mother to child. In African countries tend to be more childhood, early childhood, and in Western countries tend to be more adults. And the big difference has a major impact because whereas with adult-acquired infection, the risk of going on to chronic is extremely low. We figure that it's about less than 5%. But if it is mother to child at the time of birth, then the risk of going on to chronic infections is as high as 90%. In early childhood transmission, the risk of chronic infection is about 30%. So those have a very major impact.
Yeah, that's really interesting information and extremely important to remember. One thing I think might be important to point out to the listeners is you discussed the young children in Africa, the transmission, I guess, through household contact. So how long does the virus survive on surfaces? How are those transmissions happening?
Yeah, the hepatitis B virus is very sturdy. And if, let's say, we cut ourselves and we spill blood on a surface, we wipe it off, we can't see the blood, but the virus might still be left on the surface, and it can survive outside the human body for up to 7 days. For example, kids that may have contaminated their toys or other sort of articles at home, then other kids pick it up and use it. Kids oftentimes have cuts and scrapes on the skin. They can be easily exposed and they can transmit the infection that way. In countries where sometimes a lot of household articles are being shared, For example, they may be sharing toothbrushes. And we know that sometimes when we brush our teeth, we may have a little bit of gum bleeding. Another person pick it up. If we have nail clippers or razors and other people use it, that can also be a source of transmission.
Yeah, so that's all really important things to remember about the transmission. I mentioned that there's about 250 million people worldwide infected. Can you talk any more about the burden of disease in terms of deaths and new infections?
Although we have prevention through vaccine and we have antiviral therapy now, we still have about 1.2 million deaths every year worldwide. And part of that is because a lot of people who are infected are not aware that they're infected. This is what we call silent killer, in a sense that people may be chronically infected for up to decades with liver damage and even early stage cirrhosis, and are not aware that they have a liver problem. If they haven't been going to see a doctor and getting the appropriate test, they may not know until it's very advanced. So not having been diagnosed, not recognizing that they have a problem, means that even though we have treatment, they're not being put on treatment.
Can you perhaps briefly remind us of the structure of the hepatitis B virus and how it actually affects the liver, how it does its damage?
So the hepatitis B virus is a very interesting virus. As you mentioned early on, it is a DNA-containing virus, and it has an envelope which expresses the surface and protein, which we call the hepatitis B surface antigen. And this hepatitis B surface antigen can be detected in circulating blood, and is the major diagnostic test for the infection. But the virus only infects the liver, or at least it only multiplies within the liver. So once it gets into the circulation, it finds its home to the liver, and there's a specific receptor on the liver cell that allows the virus to bind to it, enters the liver cell. Although it's a DNA virus, it is actually very interesting in a sense that it replicates through an RNA intermediate, and then from the RNA intermediate, it is reverse transcribed into the DNA. And this is one of the reasons why antiretroviral drugs that are developed for HIV would also be effective for hepatitis B, because it's shared through that reverse transcription step. And when it gets into the liver and it causes the inflammation, so the virus itself does not directly kill the liver cells. It is more of an immune-mediated liver injury. So if the immune system is asleep and does not recognize the virus, does not recognize the infected liver cells, the virus can keep multiplying in the liver, and yet the liver at least has no damage or very minimal damage. At some stage, and we have no idea what turns on the immune system and why it turns on earlier and it turns on later in other people, the immune system recognizes that, oh gosh, there's an enemy inside my liver, and start attacking the virus and infected liver cells. It causes damage to those liver cells, and that's when we start seeing liver inflammation. And if this keeps going on, the liver is able to regenerate to some extent, so we get scar tissue or fibrosis. But if the injury keeps going on for years and years and years, even though the liver tries very hard to repair itself, it's not adequate, and that would end up with cirrhosis. And when we get to cirrhosis, if this continues to progress, get into cirrhosis complications, liver failure. And the most dreaded complication is liver cancer, which is hepatocellular carcinoma, which is most common after the liver damage progresses to cirrhosis, but can also occur before cirrhosis, because this virus is also capable of integrating into the host DNA and cause derangements in the host genome and cell repair. So there are two mechanisms of liver cancer.
I think that's actually a really important point, because hepatitis C, we think the risk for hepatocellular carcinoma is only once the individual has become cirrhotic. So hepatitis B is a bit of a different virus. So I think that's an important point for the listeners to remember. So I want to talk about the clinical presentation. You alluded to the fact that it could be asymptomatic for some time, but maybe we can talk about acute versus chronic presentation. So if there's a patient who has an acute hepatitis B infection, what does that look like?
So acute infection tends to be totally asymptomatic in babies and children and young adults. In older adults, if they get acute hepatitis B, they tend to have all the symptoms of acute hepatitis. They may have a little bit of prodrome, like a viral illness, and then they feel exhausted, they lose their appetite, they may have nausea and vomiting, and in more severe cases, they turn yellow. They are noticeably jaundiced without urine. They may have a little bit of right upper abdominal discomfort, and in very severe cases, which is less than 1%, might progress to acute liver failure when they become confused, disoriented, and the liver basically shut down. Like I said, majority of the people, the acute phase is really asymptomatic, and people sort of are surprised. How did I get it? When did I get it? And it's just because it was quiet all these years.
So many people probably don't know. If they had acute hepatitis B and recovered, maybe they don't know, and the only way you knew was from serology. Is that right?
They didn't know that they got acutely infected. Now, if they're very lucky, because they got infected as an adult and the immune system is good, they have a 95% chance of recovering, and it's really later on that, oh gosh, I have antibodies to it. How did that happen? But for others, if they got infected as babies or young children, they had a silent acute infection that then go on to chronic infection. And even during the chronic stage, they may not notice anything until they become sick because they have now got to cirrhosis. Nowadays, in Western countries, if we go for our annual check through a family doctor, oftentimes we get liver biochemistry tests. And we may be lucky in that our liver enzymes may be elevated and our doctors start looking into why and then discover that we have hepatitis B. But even when people get blood tests, the liver chemistry may still be normal because hepatitis B goes through active phases and quiescent phases. So a lot of times I would see patients who say, well, there's no way that I have been infected for so long. I've been seeing my doctor, I've been getting annual blood tests, and I've never been told that my blood tests were abnormal. It may be because you only got blood tests every 1 or 2 years. We didn't catch you at the right moment. So unless you really get tested specifically for hepatitis B, we may miss that until it is late. That is one of the reasons why CDC a few years ago said, for years, we recommended only screening people if they have risk factors. But we don't do a good job when it's target-based screening because we as doctors are just way too busy in our clinic to ask a list of 10 questions. And sometimes the patients don't even know about those risk factors. Have I been in contact with someone who's infected? How would I know? So we don't do a good job, and CDC basically saying, hey, we have treatment that works. And the only way that we can help people is if we make the diagnosis early. So let's just recommend one-time screening for all adults. We're not recommending one-time screening for young children in the U.S. because majority of them would have been vaccinated. So one-time screening, regardless of risk factors, regardless of symptoms, that way we are able to help people if they do get infected. And obviously for people with ongoing risk factors, they may be tested one time and it's negative, but that does not mean that they can't get infected later on. Now, of course, for those people would recommend, hey, if you're not infected and you don't have immunity, let's get you vaccinated now. But sometimes the healthcare system is not perfect, or our patients disappear, they didn't get vaccinated, and if we have the opportunity to see them again, we should recheck them again.
So I think that's a really important point about screening because it sounds like for chronic hepatitis B, perhaps you may not have symptoms until you're much further along. We're going to talk about treatment, but obviously we want to identify people who, if they have chronic hepatitis B, have not progressed to cirrhosis or hepatocellular carcinoma. So it's important to screen, it's important to vaccinate people who aren't immune, and not rely on signs of liver disease. Is that correct?
Yes, screening also helps if we identify someone to be infected, not only help that individual, but also to make sure that they understand, I am potentially infectious and able to transmit the infection to other people. So I'm going to make sure that people living in the same house, my sexual contacts are aware and get vaccinated.
So how do we screen? You mentioned it, but can you tell our readers what they should be screening with?
Well, it's a simple blood test. And to screen for infection, we'll test for hepatitis B surface antigen. But we also want to know whether someone has immunity or not. And for that, we test for hepatitis B surface antibody. Because in the US, we expect that very few people would test positive for infection. But knowing whether they have immunity is also important because we can then recommend them to get vaccinated. The third marker that we would test for is the hepatitis B core antibody. That actually helps us determine whether someone had been exposed to the virus before, because they may have been exposed, they may have a transient infection, and they've recovered from it, so they now have surface antibody and they have core antibody. They're okay, except if at a later stage in life, if they require very potent immunosuppressive therapy, like cancer chemotherapy, and nowadays so many biologics for all sorts of medical conditions, if the immune system is suppressed enough, the virus might still become activated. And that's one thing that we want to know. So one of the things with hepatitis B is, even for people with a transient acute infection from which they have recovered and they have the surface antibody, the virus is still inside the liver, but it's being suppressed by your immune system. If your immune system all of a sudden gets weakened, it can become reactivated again. So really think about this like herpes virus, CMV virus. You might seemingly have recovered from that acute infection, but it's still hiding in your body as a latent infection.
I want to briefly touch on treatment and prevention, two really important points. So can you tell us what treatments are available for hepatitis B?
So we have two treatments. One is the oral antiviral, which we class as an nucleoside-nucleotide analogs. And it really mainly entecavir and tenofovir. And there are two formulations of tenofovir, the TDF and the TAF. They're oral once a day. They are very safe, very minimal side effects. We can use tenofovir. We can use it in pregnant women. We can use it in patients with decompensated cirrhosis. They suppress the virus replication. By suppressing the virus replication, reduce the inflammation, decrease the risk of progressing to cirrhosis, decrease the risk of liver cancer, but does not completely eliminate that risk. The other treatment is interferon, and it's just given for 1 year. It's a subcutaneous injection. It also works very similarly, suppress the virus, maybe stimulate the immune system a little bit, but because it has a lot of side effects, decrease white cell count, platelet count, make people feel like they have a flu, fatigue, and headache. Not very commonly used. In the US, I would say 99% of the patients receive the oral form of antiviral therapy. The problem with the oral form of antiviral therapy is it's mainly suppressive, but not eradicating the virus. So it's really like treating HIV. The patients cannot come off treatment and say, I'm done. And we have to be very careful when we can stop. There's some criteria in which we can sometimes consider stopping treatment, but we have to watch the patients very carefully to avoid the relapse, rebound, and immediately put the patients back on treatment.
So quite possibly lifelong treatment.
Yeah, for many patients, it can be many years or lifelong.
Yeah, so I would like to just touch on the vaccines because perhaps the focus on prevention is a good strategy, which we've, I think, worldwide been trying to do. So can you just mention vaccines and the importance perhaps of the birth dose vaccine?
Yeah, prevention is always better than cure. Hep B is an infectious disease, and we can prevent it with a vaccine. The vaccine was first approved in 1981, so that's a long time. And worldwide, more than 1 billion doses have been given, so it's very safe. And we talk about the very high risk of chronic infection when babies get infected. So the sooner we give the newborns the vaccine, the better it would be. The WHO, as well as the CDC, does recommend universal birth dose vaccination, which basically means every baby within the first day that they're born, regardless of the mother's status, give them the vaccine, preferably within the first 12 hours and definitely within the first 24 hours. If the mother is infected, in addition to the vaccine, because vaccine does take a little while for the immune response to be mounted, you want to get the babies a dose of hepatitis B immune globulin as well to provide the immediate protection, and then the first dose of vaccine, and then finish the second and the third dose, which is usually given at month 1 and month 6. Now, we also do prenatal screening of all pregnant people, and if they're found to be surface antigen positive, we now recommend testing them for virus DNA level as well. If the mother has extremely high virus level, there's still a small risk that the babies can be infected even with the vaccine and the immunoglobulin. And we recommend that the mother start on antiviral with Tenofovir late second, early third trimester, so the virus level can be reduced to very low level. And that actually would result in a less than 1% risk of transmission from mother to babies.
I can see that the vaccines are extremely important, especially in preventing the mother-to-child transmission, which is most likely to lead to chronic hepatitis B. Well, thank you so much, Dr. Lok. This has been really informative and really interesting. Thank you for being on.
Well, it's been a pleasure.
This episode was produced by Shelley Steffens at the JAMA Network. You can find a link to the manuscript in this episode's show notes. To follow this or other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.